Hey, what's happening? This is Carroll, host of Turn Up the Volume podcast. And listen, I want to let y'all know something. You can follow us on many different platforms. You can follow me on Facebook at Deontay J. Carroll Sr. You can also follow me on Twitter at Deontay J. Carroll, no apostrophe. Also, I'm on Instagram at Deontay Carroll, all one word, no apostrophe. And lastly, you want to follow me on YouTube at Deontay Carroll because I post all of my episodes and post all of my shows from the podcast on my YouTube page. So if you want to continue to stay connected, make sure you like, share, and subscribe and follow me on all of my social media platforms. And remember, until next time, keep that volume turned up. Peace. Be blessed. What up? Good evening. What's happening? Today is Friday. What is this? April the 9th, 2021. And I'm your host. Don't laugh at me. I see you laughing, Red. I'm Deontay Carroll, host of Turn Up the Volume podcast. And I'm excited to be here again with you guys for another episode, another edition to talk about something else, another issue and another topic that you find not just in the communities of African Americans, but you see it everywhere, and that's childhood trauma. And I felt like this was very important because oftentimes we look at people and wonder why people do the things that they do, why they act the way that they act, and Michael Jackson had a song. He said, why? Tell them that is human nature. Well, sometimes it ain't human nature. Sometimes it's the stuff that we go through in our childhood. And so, I try on this podcast to not just waste anybody's time, just to be online and talking about crazy stuff, but I really try to talk about stuff that affects our people, that affects people in general, and really try to bring some intelligent folk that are experts in their field, and they can bring value, and that you guys can follow them and see what it is that they do for a living, and to really get what you need to be able to apply those things to your life. And I got a special friend. Shout out to Evangelist Apollonia Villanueva, who actually referred my guest for today to me. Because she listen, my sister Apollonia, she know everybody. And so all I had to do was say, listen, I need somebody for this, and that. And some of the guests that y'all have actually seen have been because Evangelist Apollonia has put them on my radar. And so nevertheless, it might have taken me some time, but I've reached out to people nevertheless to follow up. But without further ado, I want to introduce our guest. So we have Reverend Jessica Mitchem, MDiv, MSW, and I'm gonna let her come on. Rev, where you at, Rev? How you doing, Rev?
I am here and I am doing well. Thank you for having me this evening. I'm so excited to be here.
Listen, I'm glad to have you, and I'm glad that I know you was rushing home. Listen, we a black show, okay? So I'm gonna say some stuff sometimes that you gonna be like, I know he did not just say that. But look, I know you was rushing home and you was trying to find your laptop, and the whole time you probably panicking like, I don't want to be late. But listen, you can just relax, okay? Because sometimes we be running late. Stuff happens, all right? Life happens. But nevertheless, we glad to have you here, and I'm glad that you are able to take time out of your busy schedule on a Friday night where you probably could have been this daylight savings time, and you could have been, chilling and winding down from your crazy work week. But I'm just glad that you're here to talk about this subject, childhood trauma, and how it manifests in behaviors. And listen, I just want to jump right into it. So this topic here, it was really inspired because a couple of weeks ago we saw what was going on with Kirk Franklin, right? We saw what's going on with Kirk Franklin and his son, and the father cussing him out and cussing the son out, and then you see follow-ups days later, and then a lot of that look like to me when you do your homework and really look at a lot of what was going on of what we do know. It could have been some childhood drama, and there's even some speculation. And I'm not talking about that situation. I'm not going to focus on that too much in detail tonight about what happened between the two of them. But I want to use it as the driving piece for this conversation, because the reality is, when I look at the people of God, when I look at Christians, when I look at a lot of adults, I wonder, some of these jokers are crazy. And they do stuff sometimes, and I'll be like, why do they think like that? Why do they respond to stuff like that? Why are they acting like this? And I was really sitting. I'm like, it's the basis, because sometimes they may have had some trauma in their childhood. They may have gone through some stuff as a child that was not addressed. And so I brought you here. So I'm gonna get the floor to you. So tell us who you are, what you do for a living, so people can know exactly who you are, and that you know what you're talking about.
Yeah, so my name is Jessica. I just go by Jessica, even though I'm ordained.
I'm gonna call you Rev
I
tonight. Can I call you Rev?
have a background. Yes, that's fine. Reverend
Okay.
Jessica is still fine. Reverend
Oh.
Jess, Reverend J, whatever's comfortable, whatever flows, works fine for me. Um, so my background, I mean, I have a bachelor's in social work. At first, I was going to focus on domestic violence when I was in undergrad, and then I went to grad school trying to navigate my way of what am I supposed to be doing. And so then after that, I was working on my master's in social work, and then
Mm-hmm.
I transitioned to the School of Divinity at Howard,
Ain't you?
which was great. you know. So once I got there and I started my MDiv, finishing it is when it became clear that I wanted to focus more on mental health, more so clergy persons,
Mm-hmm.
navigating like why no one's really taking care of their mental health, their
Mm-hmm.
emotional health and well-being. You see a lot of people focus on the physical health, their physique, but not their mental and emotional health and well-being. To whether you're pastoring or just you're an associate minister or you're a community leader, like your mental and emotional health really matters. And so in my last year of divinity school is where the light bulb came on, and I began to explore like how can I help
Mm-hmm.
people. So then I went back and finished my MSW at Howard University School of Social Work, and was able to focus my concentration on mental health, like
Mm-hmm.
learning the behaviors, learning about medication, knowing that I did not want to prescribe medication, but also learning that medication helps. Like
Okay.
it helps to manage the behaviors. It helps people function and work. So yeah. And then post school, I started working with returning citizens from federal prison and helping them navigate how to get back in society, how to get a job, how to reconnect with their family. Learning that either they were diagnosed with a disorder while they were incarcerated. How are you managing now? Oh, you need to take your medication at this particular time. And then after that, I became a behavioral health therapist working with children's, adolescents, and family, providing therapy. And that was an experience.
I'm sure.
Um, because there are some parents that don't want to take the responsibility for their children and their disorders, or they just want someone to be a full-time babysitter so they can continue to live their
Right.
life.
Right.
And you chose to have this child, so you have to provide and take care and be responsible, and learn about what this particular disorder is. It's not just, oh, my child has ADD or ADHD.
Mm-hmm.
No, like something happened, and I think my belief, and just even working in that field, you need to be educated on how to take care of your child and treat your child. Some of the kids were exposed to substance use and abuse in their home, and some kids were exposed to domestic violence.
Right.
Um, Depending on the community that they live in, and I mean daily. in the past 2 weeks, we have now, what, 5 mass shootings in
Yeah.
2 weeks.
More, one too many.
Yeah.
One
And
too
so
many.
how are your children processing it?
Mm-hmm.
Right? What is the school doing? What is the community doing? Are they creating safe spaces? And so for me, as I'm growing in my role as a minister and a chaplain in the
Mm-hmm.
hospital setting, um, I'm intrigued by people's stories, and I get to hold space with them, and I get to hear, how did they get here? Sometimes they can't answer that question, but my responsibility is to hold space with them and allow them to, get it out and then help them navigate if they so choose.
Mm-hmm. So let me ask you this.
Mhm.
So how do you define childhood trauma? I think you probably answered just a little bit, but for those who may have heard the definition, is there like a clinical term for childhood trauma or clinical definition for what it is?
Yeah, so childhood trauma is not like clinically
Okay.
defined,
Mm-hmm.
but what it is, or how you can formulate your own particular definition for childhood trauma is, what is a child exposed to in the home,
Mm-hmm.
right? What's the earliest time that they may have been exposed to violence?
Right.
What is the earliest time they have been exposed to a loss? Or so, like, we can identify what a loss is. A loss is more than someone passing away. A
Yeah.
loss is like a move, um, in housing. It could be a loss in their parents splitting up. A loss is, yes, someone passing away. It could be a loss in financial support or stability, right?
Mm.
So that goes under like childhood trauma. Childhood trauma is also defined as, of course, sexual abuse, physical
Yeah.
abuse, it's so many things. And so I think people, for our generation, I think our responsibility is to educate,
Yeah.
right? I think we're doing so great at that now, opening up about the trauma that we have been exposed to
Mm.
and lived in and lived through and living through. But I also think it's about how we're able and trying to heal ourselves with the resources that are out there.
Yeah, and it's interesting because when I think of childhood trauma, and sometimes you look at various kids even today, like kids do certain things, their behaviors, and sometimes, well, at least for me, I always wonder what were they exposed to. So like for example, if a kid is young, super young, sometimes they could be like 5 or 10, and they're super sexual, or they tend to say sexual things. I always wonder, were they exposed to something? Did something happen to them? Or was there some kind of trauma to where they're now demonstrating that kind of behavior? Because see, sometimes people respond to trauma in different ways. Sometimes people who, for example, let's say somebody was molested, right? Somebody that was molested, they may respond or demonstrate behavior in many different ways. Like they may, go out here and try to molest other people, or they might just be super sexual, in their behavior because they've been exposed or traumatized. And I think the misconception is when you say traumatized, like we look for the manifestation to look one certain kind of way. So when somebody is traumatized, does that behavior look one certain kind of way, or could it manifest into different kinds of behaviors?
It does definitely manifest in different kind of
Mm-hmm.
behaviors. I think in reactions. I think if we talk about the sexual molestation from a child,
Yeah.
I don't know what it's like to be a child. I know what it's like to be a teenager being violated sexually,
Wow.
right? Um, and not sharing because it's like, what just happened to me? In those moments, your mind, your body goes into shock.
Yeah.
And it's just like, what do I do? Right? Um, so I think when it happens to kids and children at particular ages and it happens for an extended period of time,
Mm-hmm.
we can look at, hypersexuality, right?
Mm-hmm.
That's a clinical term, hypersexuality,
Okay.
and how the children or how the child or how the teenager is acting out,
Mm-hmm.
or how they are now, doing this to someone else.
Mm-hmm.
But that child that was violated, the child for so many years they were molested or raped,
Mm-hmm.
right? And they say anything, they don't share it, but now they are the ones carrying on this particular behavior and doing it to someone else.
And then they're carrying all of that pain, all of their hurt, all of the agony. When we're talking about the trauma, we're talking about the mental damage, the emotional damage, sometimes the sexual damage, and even on another level, the spiritual damage. That it does to people. And so, it really makes me think, because I deal with at risk youth. I'm in the juvenile justice system, and so when I deal with youth on my caseload, like oftentimes they have what is called like mental health evaluations, psychological
Mm-hmm.
evaluations, psychiatric evaluations, and stuff like that. And sometimes you get to read these evaluations and you see what these kids go through, and you hear a lot of times stuff that has happened to them when they were like 2 and 3 years old. And it's like, I get it. And so it makes you want to respond to them differently, because sometimes, especially in the African American community, we think that all kids are just bad and they just need a whooping. We some of
Mm-hmm.
us, we old school. I believe in that theory because I'm a black father, so that's just me. But sometimes you got to really look at certain kids and really look at how they were raised, what their parents were like, what their grandparents were like, who raised them, and
Mm-hmm.
so and so back in the day, they used to say it takes a village to raise a child.
Yeah.
Nowadays, you kind of get kicked in the head if you see something, you say something, kind of, like you can't say anything, you can't. And so I guess my thing is, what so for somebody who's on the outside looking in, right? I mean, what would you say are the signs that a person should look for? Because sometimes people do care. People do care about the kids in their communities that they see on a regular basis, and they just don't know. Like, some stuff can go over a person's radar, and sometimes a kid, could be crying out and saying, "Hey,
Mm-hmm.
I need some help." They don't know how to say it, but their behavior would suggest that they need help. So, what are some of the things that I guess a person should look for that a child is potentially going through some kind of childhood trauma or traumatic situations?
Yeah. So what parents, it could be an aunt, it
Mm-hmm.
could be school teachers. I mean, when you are a school teacher, you're a mandated reporter,
Yeah.
right? So that's just it. Um, so one thing that people should look for is isolation,
Mm-hmm.
right? If a kid is shying away, if the kid is like staying in their room, I think it's about looking at how the child or the teenager is dressing,
Mm-hmm.
right? Their personality, right? Are they talking? Are they not talking?
Yeah.
Um, Watching their emotions.
Mm-hmm.
Um, I mean, I know for myself, from my own life experience, I stopped talking to an extent,
Yeah. Sometimes you shut
right?
down.
Completely,
Yeah.
because it's like you don't know who to trust.
Yeah.
And sometimes we can say in the Black community,
Mm-hmm.
if you say something, it's like you're questioning, will your family believe you? Right? You're questioning if anyone will hear you. But then we also have examples of once the child has said something, the parent stays with the violator, and or they're silenced. They're like, don't say anything. Like, you can't tell nobody this ever, like ever. Right? You hear those stories time and time again. And it's like, when are we ever going to move from that keeping a secret to save face because we have this like family way of living, and or if it's not the way of living or the lifestyle that they're living, it's because the parent values the relationship more than my belief. I can't speak for anyone else. From what I've seen, the values having their significant other than treating and training and the responsibility of nurturing that child.
So okay, so pause right there. I want to say something. So y'all, do me a favor, because this is about to get heated up in here. So do me a favor. Do me a favor. Share this video with a bunch of people, like a rack of people, for real. Like, tag 5 people. Just put 5 random names in this video right now, and share this video. Share it to your timeline, because this is something that a lot of people are going through, and sometimes this is stuff that's unspoken. So listen. So Reverend Jess, my wife, look, she's like my biggest fan, okay? And so my wife is in the comment section, and so she had a question. She said, so, and I do want to piggyback on what you said. You said the parent sometimes stays with the abuser, but before we go there, let's answer this question real quick, because she had this question. So what is the impact of families hiding sexual trauma that takes place within, I guess, within the family realm?
Yeah, so I think if the teenager shares it, the parent, they're just like, don't say nothing, right? So you're building already distrust. There's betrayal happening. Mm-hmm. How do you expect me to have this relationship with you as my parent or the grandparents or your aunt or your uncle, because you just told me not to say nothing? This person like legit just violated me. They took my innocence from me. Mm-hmm. And so how am I supposed to have this life of, well, I'm a kid or I'm a teenager and I can't even be who I am at this particular age because I'm now in a role of survival.
Right.
So when it pertains to family, I mean, families hide it, and it's so sad that they hide it. But then if we look at it, I can only speak for being in a Black family. It goes back to generations, to generations, to generations. I mean, we can go back even into the enslavement period when people were on the slave ships, when people were, cropping through the fields of cotton and being bought. And like the slave master was like, well, I like you, or I just have this desire, so I'm just going to take it from you. And it just keeps going and going and going. And we still have it till this day in 2021.
Yeah.
We have sex trafficking and, all those things.
And when I see like series like Roots and 12 Years a Slave, I just get so upset and I get so angry when it's like we were bad enough for y'all to beat and enslave, but yet good enough for your sexual pleasure. So it's that whole concept, and then impregnate us, make us have your babies.
Yes.
And then not claim them, and then take care of them. And in my mind, I'm like, where was child support back then? Like where was child support enforcement? Where was all this stuff back then? It boggles my mind, because this stuff has been in this country since it's I'm gonna put it this way, since its illegal inception. How about that? Because we know there's people here before they got here, right? And so all of that illegal behavior, unwarranted behavior, unethical and unmoral behavior started since the unethical and unmoral and illegal inception of this country as we know it today. And so something you said earlier, that sometimes the parent will stay with the abuser. I thought about that prior to you coming online and jumping on, because I feel like it's important for parents to protect your kids from unhealthy situations. Follow me where I'm going with this. Even relationships that involve you being with somebody that you allow in your home, whether it be romantic, friendships, friends that you, associates you hang around, even unhealthy marriages. You and I are preachers, right? You and I are preachers. So we've heard people who don't believe in divorce and don't believe in breaking up the home. And if you ask some people that stayed with their abuser, and then they had children with the abuser, and you ask them, well, why did you stay with this person? Well, I mean, I can't really get a divorce because of, he didn't cheat, but even though he beat the heck out of me, he didn't cheat and all this other kind of stuff, and the church was going to shun me, or I stayed because of the kids. Well, my question is, are you really giving the kids something healthy if you're staying with them? If you're staying with the person that's abusing? Because what are you demonstrating to your children? What are you demonstrating? That this is healthy, that this is what they should look for, and so what they're going to do is repeat this abuse repeat the same cycle, and then and because we preachers, right? I'm a little low key theologian. I'm in school. We go to school. We've been to school and all that. And so technically, if we really gonna dig into scripture, technically, if we gonna really dig into what the Word of God says, for those who love to misinterpret a biblical text, okay, technically, scripturally throughout time, if you really do your research, a divorce was normal, particularly in the Old Testament, and there were grounds for that, not just the whole adultery piece, but there were grounds for it. The grounds for it, theologians will argue that the grounds for it would be to if you neglected to provide food, clothing, and conjugal love, and of course adultery. And so theologians will argue that physical abuse was covered in that, because technically what you're doing is you're physically neglecting to care for them physically, and to take care of them, and to love them, and to appreciate. And so, and even technically speaking, if we look at historically and culturally, in the Old Testament, women were always taken advantage of and always got the short end of the stick, because the reality was a lot of men took advantage of women back in those times, because if he did not give her a divorce certificate, she could not remarry, which was a norm. Therefore, she couldn't take care of herself and make sure her and her children and offspring that you gave her were taken care of. And so if we really go even further in the Old Testament, before a man left town, went to war, whatever, before he left, he was to give his wife a divorce certificate. So therefore, if something happened to him and nobody knew about it, she was free to go on and remarry. So all of this craziness that folk talking about, stop keeping your people in bondage in abusive situations, because you misquoting and misinterpreting scripture and don't know what the heck you talking about. You so heavily minded to where you ain't no earthly good, because you are really keeping folk in bondage.
Help the saints.
And listen. This is why I have my show, right? I know. Listen. Don't get it confused with the sweaters and the hoodies and stuff that I be having on, because listen, I love to make sure that my people are well educated and they know exactly when you come in here, come correct, number one, and number two, I'm gonna make sure you get a little dose of the Word of God. Sometimes I might not even say it, but sometimes when we preaching the Word of God, right, sometimes people can't handle it if you say flat out in Matthew, Mark, Luke, and John. Sometimes you gotta feed folk like babies, right? And sometimes babies don't like medicine, but if you put it in their applesauce, they digesting it. They don't know you giving it to them, right? And so my grandmother, she don't like taking pills. She don't like taking medicine. But one thing she do, she'll crumble it up and put it in her food and eat it, because she knows it's good for her. And so sometimes it's not about what you're giving folk, it's how you're giving it to them, because some folk can't digest it, And so sometimes, and this is why I have this platform and why I have this, because I want to make sure my people are educated. But I don't know if you have anything to say about that part, about people staying with abusive, partners and spouses, because that stuff is really unhealthy, and yeah. I know I said a mouthful. I'm sorry. Listen.
No. I'm reeling it in and like trying to figure out what to say or how to say to respond, because I've not been in a domestic violent relationship.
Right, and I get it.
I know people who have.
Yeah.
And I'm questioned, like, why are you staying? Right? I can think back to exactly, like I could think back to college. I was a resident assistant in college, and I had residents that were in those types of relationships. And me being me, I'm thinking I can handle these things and take on their stuff to protect, and then you still going back. And I'm like, well, why I put myself in this, right? Like, you don't see that there's nothing wrong. Like, you're not seeing that this is problematic.
Yeah.
So I think, just from my life experience, I think sometimes they don't have the strength, or they don't have the self-esteem, or they don't have the confidence in themselves to really know, like, this is unacceptable. And they probably grew up in a home like that. Right? So when we talk about our childhood trauma and how it manifests in behaviors, if you grew up in a home with domestic violence, it's a learned behavior. Right? So what you see growing up, you're going to do in your life.
Mm-hmm.
Only if you choose to go and seek therapy, like
Mm-hmm.
a licensed clinical social worker, a licensed psychologist, a psychotherapist, a licensed professional counselor
Mm-hmm.
who specializes in these particular areas of trauma, trauma informed care, cognitive behavioral therapy. Like, you want to make sure you're, like, when you're looking for a therapist, like, you have to know, and you have to, like, be very aware of yourself and the things that you have gone through to
Mm-hmm.
say, you know what, it stops here with me, right? It stops where I'm not going to allow someone to verbally abuse me. I'm not going to allow someone to physically abuse me. I'm not going to allow someone to spiritually abuse me,
Oh,
right?
that's a whole
I
nother
mean,
subject. That's spiritual abuse right there.
but it happens.
Lord Jesus.
It can happen in the home,
Yeah.
right? And so we can even talk about how even the demand of going to church as a child, and like you could catch an attitude, or if you grew up as a preacher's kid or a pastor's kid, and the things that you saw growing up, and it's just like, and you want me to go to church
Yeah.
after I done seen this?
Yeah.
And then it's just like there is a disconnect, because of course no one knows how to be a parent when the child comes. It's
Mm-hmm.
all by trial and error. But even you said it, it takes a village to raise a child. It takes
Mm-hmm.
a village to raise children, right? If you don't even know how to create a village, or as I like to call, like, building a community,
Yeah.
right? Even for myself, like in my transition and in my move to New York, I'm like, man, I got to build a whole nother community. Everywhere I've lived, I've learned that I can build community, a social support for me, while I'm there. And so I think people need to begin to normalize and understand that it's okay to build a community outside of your relatives. Like,
Mm-hmm.
you know, we go to church,
Yeah.
right? We understand why we go to church. I can identify why I go to church. I love the fellowship. I love the people, the
Yeah.
worship that takes place. But you meet people who are really on the same path as you, and then you begin to share stories like, oh, I'm going through this, or I've been through this. And then they can help you walk through certain seasons of your life,
Right.
um, so that you can navigate this thing. Like, you're not doing it by yourself. The pastor can't do it all. Okay.
Right.
And if the pastor tries, this is why you have some who are mentally, emotionally drained, burned out. They're not functioning really well at their best capacity or best ability.
Mm-hmm.
Um, so yeah.
When you
So
were
why do
talking,
people stay in the relationships? Is
yeah,
the
why?
question.
Why?
Yeah.
Listen.
I think that just the person has to answer that question themselves. And I just really think that I can give an example. I was just seeing a patient. I met her for the first time yesterday. 24-year-old. She's like, I just found out I'm 7 weeks pregnant, and my boyfriend is this. I'm like, how long y'all been together? She's like, almost a year. And in my head, I'm like, girl, run. Like, get out. Like the movie Get Out. Get
Yeah.
out.
Yeah.
Because I can see this ain't gonna be good for you. But
Right.
if you're saying like you want him to come continue to visit you in the hospital, then why are you telling me? Like, if I go and do the work to provide you resources and you want to stay, are you just wanting to get it out, or are you looking for an escape?
Right.
Right. And so for me, I had to, it was messing with me mentally. And I was like, okay. So I found one of the nurses. I was like, I just met a patient, and yeah, someone just put, Harriet put, some are afraid to be alone. That is
Yes.
true. So I went, and then I ended up talking to the clinical nurse manager, and the nurse manager just laid it all the way out for me. I said, thank you for helping me. I said, because it was a trigger.
Mm-hmm.
I said, I can detach now. And how can I best provide care or create space for this particular patient to share what she chooses to share,
Mm-hmm.
right? it's about control. I think if you're in an abusive relationship, people are controlled. And then, like, when you're a kid growing up in that environment, it's just like, well,
Man,
I don't know any better. Like, I've never seen any better.
right.
So this is what sometimes I've heard people say, well, this is how I know I can receive love
Mm.
or feel like I'm wanted. I'm gonna stop.
See, so you said a mouthful, and I'm gonna just piggyback on what you said. So why is and this is why once again it's important to protect your kids and to make sure that, hey, if you wake up and smell the coffee one day, say, you know what, while I love you, I'm realizing this ain't healthy for my baby, because you bringing not just all that bad energy and bad vibes, but if I keep you, I'm telling my child that, hey, as a woman, let's say, for hypothetically, as a woman, and I have a daughter, it's okay for her to have a man beat on her because she watched her daddy beat on her mom. And so
Mm-hmm.
no, that we gonna stop that right here and now. And so that what that does is that lets my daughter know, hey, if you find yourself, because see, sometimes we can protect our children, but when they get adults and they make their own decisions and things of that nature, we don't know who they're gonna fall in love with. That's just the unfortunate key fact, right? But if you do find yourself in a situation, know that mama or daddy went through the same thing, and mama or daddy walked up out of it. And then before I get to this next question, you talked about triggers. I can't remember if you said that it was something that triggered you in particular, but triggers, because that's one thing I wanted to talk about, but you was on the money by mentioning it already. And so triggers is something that's very, very, very important when you're talking about childhood trauma, because even though a child may be rescued from certain situations, we can't neglect that sometimes children can be triggered by the trauma that they faced or the environments that they were once in. And I remember when I was a child, and so sometimes when we think about children, it's not always, children five. Sometimes when you're a teenager, because you're a minor still, you're still considered a child, and so sometimes you experience stuff that can be traumatic. And so for me, and I don't, and I, I'm sure my mother won't mind me telling her story because she does work at our church with domestic violence and telling her story to different people. But my mother was in a domestic violence relationship. And my mother was stalked by her boyfriend, found out he was doing PCP and crystal meth and all this other kind of stuff. Took her car for like 3 days, and we didn't know where he was, and come to find out, she was done with him, and so he started stalking her. And I was in high school. I was in like ninth grade. I was in high school, walking out of the house. Now mind you, his mama lived up the street a couple doors down, so that's where he was staying. And so he would stalk her, watch her when she would come home from work, try to be at her job, all kind of crazy little dumb stuff. Knew we would leave out in the morning to drop me off at school, so he would be outside lurking, hiding behind trash cans and trying to chase the car and chase her and all kind of stuff. And so it got to a point to where I was walking outside with pocket knives and stuff like that, you know what I'm saying? And like really that experience, my response was I had to grow up pretty quickly, because I'm like, I gotta take care of my mother. You know what I'm saying? I didn't like to fight. I'm a chill person, but when I feel threatening, I'm like, my back is against the wall, I'm gonna come out swinging, even though I might get some bumps and bruises. You know what I'm saying? And so for me, even though he ended up doing some time in prison and all of the other kind of stuff, some years had went by. I think by this time, I think my mom I think she was about to get married or something like that. But anyway, my stepdad was in the picture. And so I went on a vacation with a family member. I'm going to leave him out. I went on vacation with a family member. And one of the other family members who was on this vacation assaulted their girlfriend while we were sleeping. And I didn't tell my family. They didn't know that my mom had gone through what she had gone through. But I had called my mom, told her what was going on. And I was like distraught. I was just done the rest of the vacation because I was triggered, and something reminded me of something. And so I'm like, I'm done, and I knew my mother was going to go off. So I was like, don't say nothing. It's almost over. I just want to just, endure the rest of this vacation to get home. But I say that to say, like, we really have to protect children even after they get out of situations to make sure that we're not mistakenly or unintentionally allowing certain triggers, certain buttons to be pushed to trigger them off, and to put them in the place to where they feel like they're reliving something all over again. And so triggers are something like can you talk about that triggers thing for a minute? Because I know I done told my story, but that trigger thing is it's vicious. It's vicious.
It's very vicious. It's very uncomfortable. It is your body goes into shock, your mental goes into shock, and it's like, what am I supposed to do? So you go into survival role. You go into, do I fight or do I fly?
Yeah.
Right? I don't think people really understand or take the time to really like hone in and focus on, I just got triggered. Right? I don't think people really deal with their traumas. Right? So if you grew up in a home with domestic violence, and then now you are an adult and you're like, as you said, in your experience was exposed on a vacation and it just jacked up your whole vacation.
Yeah.
It took you back to what you experienced your mom go through.
It did.
Right?
It did.
And so like you have to center yourself and check with yourself, like, I experienced this. What did I feel and think when I was this particular age? Now that I'm this particular age and I'm here, am I supposed to be doing something?
Yeah.
Did I do something? Could I have helped? Right? And the triggers, the triggers can manifest like physically into like anxiety and panic attacks. Right? Like, it manifests in so many different ways in humans that if we don't take the necessary time to really address our traumas, how do you expect to really be in relationships? People talk about, I want a relationship and I want this, but the most important relationship one should have is with their self.
Right. Talk about it.
If you don't have relationship with yourself, how can you expect or how can you anticipate to build relationship, as we like to know, intimately with someone, right? You have to be able to teach someone, who you are, things about you, what are your likes, what are your dislikes, right? And present day, I think we need to be able to talk about our traumas if this is a person, if you're going to have like a long-term relationship with, so that they know, I can't do this or I can't do that. So for me, it's like relationship, like if there's a couple arguing, like high escalated voices, I'm very sensitive to those things.
Yeah.
I'm leaving. Let me exit the room, exit left. If it's physical, it's my time to go, right? Or I'm gonna call the police. Like, this ain't for me to do, but the police can handle it.
Yeah.
So triggers, I think people need to really know what they are. I think people really need to address. Yeah, I think people need to also address what their trauma is, whether it's sexual, whether it's emotional or physical abuse. If it's even dealing with the loss of a relative, and how did you hear, or where were you at when you had this loss, right? Yeah. And it could be from a car accident that you have this trauma and you're avoiding particularly driving a particular way, or you don't want to go in a car. It's a myriad of things.
Yeah, and triggers are very important with anything, whether it be childhood trauma. Like, I wrote a book, and I talked about in my book, Saved, Sanctified, and Addicted to Porn, Overcoming Sexual Perversion, right? And so one of the chapters in my book, I talked about knowing your triggers. So even in an addiction, you have to know what your triggers are. Because sometimes if you don't pay attention to what your triggers are, you lose kind of control as it relates to what your response is if you don't know what those triggers are, in my opinion, and so if I know what my triggers are, I know to stay away from certain people, certain situations, certain conversations, because I know if I'm around for another 5 minutes, it's going to trigger something. And my wife loves to say it, the best thing to do is to remove yourself from a situation, particularly if it gets heated. If it gets too tense for you, and you can feel that it's about to trigger you, So for those that are watching, that you've had traumatic situations happen to you or childhood trauma, one of the things that can actually help you is knowing what your triggers are. Like if you're talking about dating, right, or courting or what have you, they're a little condescending. So I'm gonna stay away from dating that kind of person, because that signals abuse and that triggers something for me. So I'm gonna stay away from you. Or this one, you too controlling. That triggers something because I done came out of something abusive like that. So I'm gonna stay away from. I'm gonna pull back, and sometimes, and you ain't gotta tell everybody. A lot of times, just sometimes. Listen. So they might not appreciate your presence, but they doggone sure gonna feel your absence. So sometimes you ain't gotta say nothing. Sometimes it's just you making the necessary moves and just doing what you got to do to remove yourself from the situation. But sometimes you removing yourself is like somebody taking off their shoes and saying Deontay was here. Like that's all it is a lot of times. So I mean, that's all you got to do sometimes. But so wait a minute. So we had two questions. I'm gonna go to this question. How do you norm counseling from someone who feels it's not necessary or carry misperceptions about it? Now, Rev Jess, answer that one lightly, because I do want y'all to know, Reverend Jess, she's going to come back on the 30th of April, and then we're going to talk about something else called, what did we say it was going to be?
Well, Jesus in therapy, but we
Jesus in therapy. So Jesus in therapy. So she's coming back. I'm letting y'all know. Reverend Jess is going to come back on April the 30th. We already done settled it. She's coming back April the 30th. Today we talking about childhood trauma, and we talking about the believers and the people of God on the 30th who don't believe in therapy. You got to pray everything away. Sometimes you need some therapy. Sometimes you need individual counseling. So she's going to come back and talk about individual counseling, the types of counseling. So you can answer the question, but answer lightly, because you're gonna do a whole nother segment in a couple of weeks though. So go ahead.
Yeah. I got you. So how do you normalize counseling for someone who feels it's not necessary? I think just as being in our community as a Black woman, for me, normalizing it is just sharing my experience and how I've been healing from my trauma and the things that I've been through. Mm-hmm. I know where I was. I was just talking to my godmother on my drive home this evening, and I'm like, like if somebody would have known me 10 years ago, like she was the first one to tell me, you need to go to counseling, Jessica. And I was like, no, I'm a social worker. I'm good. No. It has been the best thing in my life for the past 10 years that I am so much of a better person because of it, right? And I just started back yesterday. I was on a 6-month break. Because you went to therapy
or counseling? You said counseling?
Yeah, I had a psychotherapist.
Okay.
I'm very clear why I choose psychotherapy for the things that I've been through, and then just even where my life is present day. And so the therapist was like, we just did the consultation, and he was like, you just need a space to just get it out. I said, yeah. He's like, from the things that you're sharing, he was like, I can't diagnose you with anything. I was just like, that's fine. I don't want a diagnosis. I just need a safe space where I'm not going to be judged. Mm-hmm. I think demystifying what the church has done, or how people say, well, if you're going to therapy, you're crazy. Well, if I'm crazy, at least I'm getting someone to help me.
Yeah.
Only crazy people go to the psychiatrist. Well, a psychiatrist, as we will get into it in a couple weeks, treats only certain things, right? Yeah. So being able to identify the differences, and just share, like, there's different kinds of therapy. There's different types of treatment. So I just think if you're going, and I encourage people all the time to go, it's the best thing since sliced bread in 2021.
Listen, I went to therapy. I went to therapy before I got married. Me and my wife, we did. And it got to a point to where I went by myself, and she came with me, because I went through a divorce, and so there was some traumatic things that I didn't even realize that I had went through that I needed therapy for, and that were manifesting well after I was divorced. And so, certain behaviors or certain things I would do or think and respond to certain things. And I was kind of like, when I was going through my first divorce, I was like a soldier in a war. Like, I was focused. If I was getting cut, I didn't realize I was getting cut. But when the dust cleared, you ever know when you get cut, you be like, "Why I feel like something? I done got cut. Like, what is that?" And so now you dealing with the wounds afterwards. And so I agree. Therapy, counseling, whatever it is you got to take, go on, take it. Because listen, it's beneficial. It will help you. And one thing that we're gonna talk about when you come back is, and you touched on it briefly because of where you are right now in the profession that you do now, right? You a preacher, I'm a preacher, so it's like, who does the preacher go to? Because sometimes we get bombarded with a lot of stuff. People come to us for counsel, and all that. Like, who do we go to? And a lot of times people don't look at that. They don't pay attention to that. And sometimes the preacher needs the outlet. Sometimes the therapist or the psychiatrist, they need an outlet because they are bombarded with so much stuff on a regular basis. And I'm doing shows like this because sometimes we need to just stop, think, and take care of our mental health, our emotional health. And sometimes that'll even spill over into our spiritual health as well, because sometimes if we can get this mental health straight and this emotional part straight, then we can think straight to be able to focus on what God wants us to focus on. And so trust me, believe, y'all get excited because in a couple of weeks she coming back and she gonna talk about that. But
Yeah.
so look, Rev, I did my homework. That's just me.
Okay.
I did my homework, and so I found some numbers, right? And so
Uh-huh.
I don't know if you can see it. I'm trying to pull it up now. Uh,
Well,
let's
as
see.
you're pulling it up, I wanted to touch on, it's unfortunate the
Yeah.
as we can say, the untimely passing of DMX.
Yes, yes. May he rest well. And let me tell you something to the people of God. Listen, I know y'all got all kind of thoughts and stuff, with the whole drug thing. And sometimes when folk die, some of us love to go in and be like this whole "I told you so." The man just died. He got kids in the family. Before y'all start going crazy, can you just have some kind of humanity and just, like, wow, compassion. Man just passed away. Okay, we can talk about
Yeah.
that stuff later. Just the fact that somebody lost a father, a brother,
Compassion.
you know. But go ahead, I'm listening. Then we're gonna look at these stats real quick.
So, because it ties into our topic of childhood trauma and how it manifests,
Yeah.
and his first exposure to it was at 14 for a lace blunt, and it's
Wow.
so unfortunate that this is the thing that sent him over. Like,
Mm.
we don't know what he was mentally, emotionally dealing with in this pandemic. So many people are dealing with so much in this
Man,
pandemic,
you ain't
and
lying.
I can't say it enough. It's so unfortunate that what shifted his perspective mentally at 14, what took his innocence at 14, is ultimately something that just end up ultimately having a huge part in ending of his life, right? The
Hmm.
drugs caused the heart attack. So he lost a lot of oxygen to his brain. I'm not a doctor,
Yeah.
but I hear this stuff all the time.
Yeah.
He lost a lot of oxygen from the blood not being pumped in his heart to his brain. It's so unfortunate that he was exposed, his innocence was taken, and that happened so much to so many children that it's like, for real, it's so unfair
Yeah.
that children are exposed to so much, and sometimes they don't even know how to compartmentalize. I'm not even a child anymore because I was violated or exposed to violence or
Mm.
exposed to drugs or alcohol. I had my first taste of a drink at this particular age, and it's just
Mm.
like, yeah, so that's how it manifests, my belief, from just even what I've seen in my career field. Um, yeah. So these numbers.
Yeah. Real quick, hey, I want to say hey to my aunt Gwendolyn Brooks, the Reverend Gwendolyn Brooks out of Baltimore, Maryland. Hey, Auntie, listen. I'm trying to reach out to you. I want you on this podcast because you got a lot to say too. But back at these numbers, I looked this up. 35 million U.S. children have experienced childhood trauma. And then another one I found was a third of U.S. youth from ages 12 to 17 experience two or more types of childhood adversity that are likely to affect their physical and mental health. That's too much for me. That's too much for me, and those numbers are too high. Too high. They need to cut it. You need to cut it. Right.
Imagine the weight that they're carrying, the children who are exposed to it, right?
Yeah.
It's disgusting, the weight that the youth are dealing with their trauma, or the things that are happening. You can look at eating disorders because of physical. My mom told me I need to be thin and this, that, and the third. And I just be looking like, child, whatever. Like, I'm a little rebellious, so, and a little bit of a rebel. So, I'm gonna help free you though, because that's what God called me to do, to help free the people. So, the numbers are very alarming. Yeah. But also, it's just like, what will our government do to help with the resources to help when children are exposed to these events?
You know what I thought about? Think about all of those. You talked about children. What is the government going to do? I'm thinking about the children that are at the borders. Now.
Yes.
What about all the trauma that they're going through at this moment, being separated from the parent? That kind of sounds familiar because from the illegal inception of this country, you had slave masters separating children from the parents and separating the father from the home and the mother and selling the babies and selling the father, selling the grandmother and all this other kind of stuff. So that kind of behavior is still here. Like, we still see that behavior. We still see that oppressive behavior still manifesting, along with seeing that traumatic victim behavior manifesting, and so it's just interesting. Like, what is the government going to do? What are they going to do about all this? I don't know. I mean, but
we don't.
I don't know. But so we had we had another question, and y'all got the questions coming in. I think this is a good question though. In line with that, can you explain bystander trauma? Some people feel like it's traumatic only if it happens to them directly.
No. So there's this thing called secondary trauma and tertiary, that's the best way I can say it, trauma. So you're not physically, like, it's not happening to you, but if you're there or if you're hearing the story, it plays a huge impact on the person who's taking it in through their ears, through their mental.
Yeah.
Right? And it impacts them. And sometimes they don't know what to do with it. So it's like I told my godmother and my therapist, like, I don't want to talk to my friends and my family about what's going on because what I carry is heavy. Like, and they can't, my belief, I don't think they can handle, and I don't think it's fair for me to share, the things that I'm experiencing, completely share. I'll share some stuff, but completely share the weight of what I carry when it pertains to the work or the patients, and just the things that I've been through.
Yeah.
Right?
Yeah.
And it has a huge impact, I think, mentally and emotionally, for the bystander in that, hearing that particular story.
And so to any child that may come across this video, regardless of how old you are, if you find yourself going through any kind of traumatic situations, don't keep it to yourself. Say something. And once you say something, and I know sometimes we say, well, mommy and daddy might not believe me. Go to somebody else who's going to listen. It's somebody
that's going to listen.
Yeah.
But also, I think it's about someone that you have trust in, that someone who's really going to hear you. Like, it's not just the parent, but I think it's about, like you said, the village or the community that's around.
Yeah.
right? Like, so if you have that trust in that teacher, share it with that teacher
Yeah.
or the
It's
school counselor.
somebody always willing to help, and to help you get, whatever help or justice that you need to make sure that those people cannot harm you again, and that you get the information that you need to make sure that as long as you're mentally aware, you can keep yourself away from certain situations. And sometimes we can't control what happens to it, 'cause sometimes we don't see certain stuff coming, but people that will give you the information that you need to say, hey, this is what you need to look for in the future, so you won't find yourself in a situation like this again. But so I want to ask you this before we wrap it up: how can parents help their children who've experienced childhood trauma? Like, I know we talked about briefly therapy and stuff like that, but how can parents better mentally, emotionally, and even sometimes spiritually support their children who have gone through traumatic situations?
I think they need to become proactive
Okay.
in terms of finding the resources, um, more than them finding the resources, but utilizing the resources that are there. Um, Not judge your child, not
Mm-hmm.
condemn them or belittle them. For sometimes things happen outside of the sight of a parent. And so it's like the parent should not blame, the parent should not blame or shame
Yeah.
themselves or the child. Sometimes things just happen. And
Mm-hmm.
sometimes we can't answer to why they happen. But I think the responsibility of a parent is to hear their child,
Yeah.
to love and nurture their child with care and compassion.
Mm-hmm.
But sometimes, like, some parents don't have those skills to do that,
Mm-hmm.
right? So then it's just like, what is the parent supposed to really do? And my hope would be that they have a community, and that member in that community, that member in that family system, can help that parent navigate how to best
Mm.
support this child, um, for the trauma, for whatever they were exposed to, so that they don't carry the guilt, the shame, the anger, the resentment, the bitter. I mean, the list goes on and
It goes
on
on.
for what happened in their childhood. And if they're not able to address it as a child, I think that as you get older, I think for myself, it was, someone seeing something was like, I need, or I want to help Jessica.
Mm-hmm.
One, become the best version of herself. And so my advice or my suggestion to her is go seek a therapist.
Yeah.
Parents can help by not walking in denial. Yeah, that's real. Or
Mm-hmm.
acting like it never happened.
And
So
that can
yes,
never
it's very
happen.
real.
Like it never
Yeah.
happened. Like, no, don't. And sometimes, and then what happens is, when that happens, when the child gets older, because you didn't believe the child, and they told you such and such touched them or did something to them, and you didn't believe them, and then when the child gets older, now you wondering why your child don't come around. Now you wondering why your child not taking care of you, because you claiming, well, I took care of my child, I did this, and I put clothes on their back. But in a time when you should have been protecting them, when they came to you, you either walked in denial and didn't believe them, or you turned your head because for whatever reason you said what goes on in this house stays in this house, and you ain't want nobody else to know. And so now your child is growing up 20, 30, 40, 50 years old, still holding on to this trauma. Can't get ahead in life, can't
Mm-hmm.
even keep a job because of the trauma, can't keep healthy friendships, networks, and relationships because of this trauma. Because every little thing is triggering them, and
Yes.
it went unaddressed because all you thought the only remedy, how sometimes black folks sometimes love to think the only remedy is ginger ale. The only remedy you thought was just go to church and pray about it. No, your child, your baby need help. And so and that's the thing that we have to really pay attention to, and really do better. And like I said before, this is you know this is their platform to where if I can help somebody, even if it's one person watching, hey, listen. Before I close out, um, I want to give y'all this number here. Okay, so look, if you find yourself going through situations, look, it's help. If you don't know who to go to, you don't know the first step. Listen, there's a couple numbers that I done found that you can find. Disaster Distress Helpline 800-985-5990. If you're going through some child abuse or you know somebody that's going through child abuse, National Child Abuse Hotline is 800-422-4453. And then lastly, because sometimes traumatic situations will cause people to commit suicide. And so that National Suicide Prevention Lifeline is 1-800-273-8255. And so I want y'all to keep those numbers in mind. Write them down. Take a picture. There's all kind of ways you can keep track. Look them up. And if you know somebody that needs to get a hold of a hotline, share this with them. Get them some professional help. Yeah, like Reverend Brooks, she said real help, professional help. Yes, we need professional help. But once again, this has been yet another edition. Thank you so much, Reverend Jessica Mitchell. Thank you so much. Any final words before we close out?
Oh man, yeah, thank you so much for inviting me and having me on your show. Turn up the volume.
Yes.
It has been a great joy. I love to share about mental health and trauma. And so, however, we can, get people the help and the resources and just sharing life experience. It's always an honor to share. So thank you. And I look forward to coming back.
Listen, I told you it wasn't gonna be that bad. I told you it wasn't gonna be that bad. You gonna forget that an hour has even came and gone, but we have really made it an hour. But thank you so much, Reverend Jess. I can call you sis now. I feel like you're my sister. I feel like I've known you for a long time now. It just be feeling like that sometimes, when you get around family. Shout out to Evangelist Apollonia for sending you my way. Listen. Good people. I try to bring good people. I try to bring people that know their stuff. I try to bring people that can provide any kind of help to empower my people. And so use good peoples. And I always tell people that come on here that really bring it. Listen, understand you're gonna be back. You're gonna be back on this show. And so we already in the schedule because you're coming back on the 30th. So listen, when you come back, we talking about Jesus and therapy. All right, so we done talked about childhood trauma. Now we're gonna dig deep into the people of God who are going through certain things, and the misconceptions about therapy, and how do you find that balance between Jesus and therapy and all that wonderful stuff. But Reverend Jess, hold tight. Let me close the show out. Don't go nowhere. Because let me close this show out, and so I can talk to my people real quick. But I do want to thank Reverend Jess for coming on and talking to me. Thank you so much. Listen, do me a favor. I know you're about to go offline, but this is going to still be on Facebook. Tag some people in this video. Share it. What have you. If you know people who've gone through traumatic situations or they may have experienced some kind of abuse or what have you, listen, get this to them. Get them the help that they need. Help them out by giving them something positive to look at. Not only look at, but to direct them. You may not be able to help them, but show them the way to somebody or something who can help them. All right. And so listen, this is what my show is all about. I know we laugh, we talk about all kind of stuff. I want my show to always be that one-stop shop that every week you never know what you're getting out of Turn Up the Volume and out of us and the guests that I tend to bring on here. But once again, thank you so much, Reverend Jess. Listen, next week we got another show next week. I always try to keep stuff lined up. So next week, y'all, I have somebody that I highly respect, Pastor Damon Richardson. He's going to be here next week on April the 16th, 2021. And we're going to be talking about a theological issue called tithing. The misconceptions. What does the scripture really say? We're going to dig deep into it. And y'all, if y'all have never seen Pastor Richardson in action, this is a phenomenal theologian of our time that I follow, that I respect, and that I really look at, and he really makes you think. And so let's come back next week and have a conversation about that. The week after, I believe, We're going to have somebody lined up. We're still working on that. But then we have on the 30th, if I'm not mistaken, if I got my dates right, that's when Reverend Jess is going to be back to talk about Jesus in therapy. All right. So y'all do me a favor. Share this video. Like I said, tag people. And listen, I love y'all. Be blessed. Have a good week. No matter what's going on in your life, don't let nobody take your voice from you. Your voice is one of the most powerful things that you can have. Not money, not a bank account, but no, your voice, what you have to say, what you have to offer. And until next time, no matter what nobody says, whatever your opinion and your thought is, do me a favor and say it with your chest. And do me another favor. Until next week, keep that volume turned up. Be blessed, and I love y'all. And hold on for a second, Reverend Jess. I'm coming back to you. See y'all next week. Love y'all. Be blessed.